in this episode of Say Ah.
We have a crisis in this country with high blood pressure.
Trying to eat a low-salt diet makes a big impact on how you treat your hypertension.
Women should exercise during pregnancy.
Looking good.
Training with Brian was a shock to the system.
All that and more coming up now.
It's important to get an accurate diagnosis.
You're not really different from anybody else.
First thing I notice is a runny nose, itchy eyes.
The most important step is just good hand washing skills.
Hello, and welcome to Say Ah. I'm Melissa McGurran. More than 74 million Americans over the age of 20 have high blood pressure, also known as hypertension, often called the silent killer, because left unchecked, hypertension can lead to severe health problems and even death. But as you'll see, this is a condition that can be managed successfully with the aid of healthcare professionals, medication, and lifestyle changes. Let's take a closer look at how to manage hypertension.
We have a crisis in this country with high blood pressure. This is almost an unavoidable process unless we do something about the disease.
So we're still getting a number that's higher than it should be.
Why is it a crisis? Because it's not just high blood pressure, it's what it leads to, the burden of heart disease in this country. We're talking about high blood pressure, something that healthcare professionals would call hypertension.
Hypertension is the amount of work that your heart has to do when it's pumping blood to your entire body. So every time your heart beats, it's beating against that pressure, and that is your blood pressure. When that blood pressure is elevated, that means you have hypertension.
We don't know the cause of hypertension. For 95% of people who have high blood pressure, we understand a lot about it, enough that we have medications that we can control it, but we really don't know what causes it.
Let's lay back. I'm gonna have you relax.
If hypertension is left untreated, it can lead to multiple complications, and those complications include heart attack, congestive heart failure, stroke, and kidney failure.
110/70.
My hypertension caused me to have a stroke. Once I had the stroke, it changed my life. I was unable to move my right side of the body.
Officer Wilkins came to my care in the hospital when I saw him after he had developed an acute stroke. And at that time, he had hypertension, which he really did not know about going into this. Somebody could be totally asymptomatic and still have pretty uncontrolled hypertension. So the first thing is to get yourself checked out.
If you wait for the symptoms, you've waited much too long, and sometimes too late, to do any reversing of the damage that's already done.
Hypertension is diagnosed by taking your blood pressure in your arm. Usually a nurse or a doctor, they put a blood pressure cuff around your arm and then they listen for sounds that allow them to see what your numbers are in terms of blood pressure. And if they're elevated, then that can end up leading you to the diagnosis of hypertension.
Before surgery, you had high blood pressure.
There are many factors that can lead to increasing somebody's chances of developing hypertension. Some factors you have no control over. Some of it is dependent on genetics.
You're more likely to develop hypertension if you have a parent or grandparent that had hypertension.
Hypertension does run in my family. My mother has it, and one of my older brothers. I am taking medication. I have 3 tablets that I take, 2 in the morning and 1 at night.
It really takes an average of 2 to 3 medications to help control blood pressure effectively. So I think sometimes patients come to me and they end up getting a little bit nervous when I say that I have to add another pill, but in truth, that's actually the average.
There's no reason to be intimidated. There's no reason to think, I'm going to get some medicine, it's going to make me feel drowsy, it's going to drag me down, I'm not going to be functional like I'd like to be.
They basically affect the way our arteries work in our body, so they help relax the arteries, and then they also can affect hormone production as well inside your body that can end up reducing hypertension and getting it under better control.
You know, the diagnosis of hypertension is not a death sentence. Management and control of your high blood pressure can be associated with a very healthy, productive life. Now, it's very clear that once you understand that you have high blood pressure, you need to behave differently. It doesn't have to take away from your quality of life or your longevity of life, but you have to be aware, you have to be proactive.
Medication is only one way that Kenneth and countless other Americans are controlling their blood pressure. When we come back, we'll learn how some simple lifestyle changes can help manage hypertension.